Hey guys, I'm Achintya Singh, and on behalf of all my co authors, I'm glad to share our paper. We studied the occurrence of gastric cancer in patients with juvenile polyposis syndrome. Juvenile polyposis syndrome, or JPS, is a hereditary cancer syndrome characterized by hematomatous polyps throughout the gastrointestinal tract. It's a rare syndrome seen in about 1 in 100,000 people. The hematomatous polyps are predominantly seen in the colon and the rectum, but can also be seen in the stomach, small intestine, and other places. JPS is characterized by mutations in the SMAD4 gene and the BMPR1A gene. There are almost 10 to 20% of the people who would not have any pathogenic variants at the time of testing. These syndromes are familial syndromes, but de novo mutations have been described in as high as 20% of the population. They have a very high risk of developing colorectal cancer, but the risk of developing gastric cancer is less well known. Patients with SMAD4 pathogenic variants have a definite high risk of gastric cancer, as high as 25 to 30%. The risk of developing gastric cancer in other pathogenic variants like BMPR1A variants and those without any pathogenic variants is still not known. The present guidelines recommend early initiation of upper endoscopic surveillance in all cases of JPS, irrespective of the underlying genotype. For this reason, we conducted the systematic review. Our primary outcome was to assess the prevalence of gastric cancer in all patients with JPS. The secondary outcome was to assess the occurrence of gastric cancer based on the underlying genotypes. We searched three major databases, Medline, Embase, and Scopus, for all studies that assessed gastric cancer in patients with JPS. The individualized search gave us 11 studies, including 637 patients with JPS. These were mostly done at tertiary healthcare centers, and there were 2 multi-center studies. Rest of all of them were single-center studies. The overall risk of bias was moderate, and the biggest risk of bias was of selection bias. The primary outcome of gastric cancer, the pooled occurrence was about 3.5%. When we assessed only those patients with proven SMAD4 pathogenic variants, we had 9 studies that gave us a very high prevalence rate of about 10%, with associated high heterogeneity in the reported studies with an I-square of about 50%. When we compared the occurrence of gastric cancer in patients with SMAD4 pathogenic variants with those without SMAD4 pathogenic variants, the odds ratio was almost 11 for patients with SMAD4 pathogenic variants to develop gastric cancer. The risk of gastric cancer in patients with BMPR1A mutation was very low. There was only 1 patient with BMPR1A pathogenic variant that developed gastric cancer in our included studies. Interestingly, patients without any pathogenic variants, there was not a single case of gastric cancer reported. There were studies that did not assess the underlying genotypes, and in those studies, the pooled occurrence of gastric cancer was almost 7.5%. Our study has some limitations. First, these studies are small studies, and there's a definite risk of selection bias based on the rarity of JPS. Other risk factors for gastric cancer, like smoking, H. pylori infection, could not be assessed in these studies. And third, we could not determine a particular surveillance intervals that could be recommended for all patients with JPS to prevent gastric cancers. To conclude, there's a high risk of gastric cancer in all patients with JPS. Almost 1 in 25 patients with JPS will develop gastric cancer. But this risk is even higher in those with SMAD4 pathogenic variants. It's almost 1 in 10 patients. This is why it is very important to check all patients with JPS for the underlying genotypes. The benefit of surveillance for patients with no pathogenic variants or those with BMPR1A pathogenic variants is remains unknown. Future studies are required to find out the optimal surveillance intervals for all patients with JPS to prevent development of gastric cancer. At this point, I sincerely hope that you're more interested in our paper, and go check it out at GIE website. Thank you so much for listening. Take care.